Hey, this is Dr. Story. If you're a chiropractor, how do you tell the difference between whether the person has an L5, L4 subluxation versus a sacroiliac joint or sacrum subluxation? Well, I've been in practice for 22 years and I've come up with a way to determine this, and I'm going to share it with you. If you're a patient, this will probably be of interest to you, and hopefully your chiropractor uses some methodology to determine this, because I think it's extremely important in getting good outcomes with lower back pain. Now, the first is what we're talking about is trying to decide, is the chiropractor essentially going to adjust you at the L5 or adjust you at the sacroiliac joints? And the answer is, sometimes in the history you can get some clues as to where you're going to be adjusting them. Now, if a person is asked where do they hurt, very often what they'll do is they'll either use the palm of their hand or the back of their hand, and they'll just run it down the belt line. And they'll say it just generally hurts here. Now, why can't patients be specific of where it hurts? We all know that the reason why is because the nerves of the superficial skin of that area are not very dense. And so it's very difficult for patients to determine where pain is located, specifically in the low back. Also, there are some referral patterns where the pain will start essentially in a bullseye and radiate out, and patients just can't tell you where it hurts. So sometimes in the history, by them pointing to where it is, they won't really clue you in much, other than if they actually take their finger and point to their sacroiliac joint. So if they point to the sacroiliac joint, you either know they're getting a hypomobility or a hypermobility, but you know it's probably a sacroiliac joint dysfunction, and you're probably going to be doing something to their sacroiliac joints to make them feel better. But if they put their hand across their belt line, sometimes it still could be a sacroiliac joint. In their history, though, if they say that when they walk, it hurts, generally speaking, that means it's probably a sacroiliac joint. Not always, because a locked sacroiliac joint could lock down the sacroiliac joints, both of them, and they could be getting hypermobility at the L4, L5 vertebrae, and thus actually it's still a sacroiliac joint problem, but they're getting pain from the L4, L5. So there's not a whole lot of things you can ask in terms of the history that would help you benefit where to actually adjust them. Sometimes patients will go from a seated to a standing position. I found that sometimes that can be an L5, sometimes it could be a sacroiliac joint. So in the history, we were taught in school, and for the most part in other areas, the history can give you some clues and information. But in the lower back, it's not as important, in my opinion. So there are a couple tests. The first is the standing gelée test. I always start out with just looking at their posture. If someone's standing there and their hips are like this, you're going to suspect things lower down. But we're going to assume that a person has a level pelvis. And what I'll do is I'll place my thumb on the PSIS and then my thumb on the sacral number 2. And then I'll have them raise, for example, the right leg. And I'm looking for motion of that right sacroiliac joint. Now, in that position, if I have my thumb on the right PSIS and my left thumb on the S2, and they raise their right leg, I'm looking for motion of the sacroiliac joint on the right side that's not weight-bearing. Then I will have them put the leg down. I will have them raise the left leg. Now I'm looking for relative sacral motion on a fixed pelvis. Now this is important, because if a patient is going to have pain and lack of mobility when they raise their right leg, generally speaking, I'm going to be adjusting an AS ilium. So we're going to be adjusting their sacroiliac joint. I may also do some muscle activation technique on their psoas, and very often when you find a person who has limited range of motion of the right sacroiliac joint, when they raise the right leg, you adjust them as an AS ilium, do some other things to their psoas muscle, they literally get up off the table, and before you even can retest them, they usually say, wow, that feels so much different and better. I mean, almost instantly. Now, if you have your thumb on the right sacroiliac joint, the right PSIS and the S2, and they raise their left leg and they get pain in the right sacroiliac joint with relatively limited range of motion of that sacrum, what happens is I will have them lie down on the right side and adjust the sacrum onto that right pelvis. Again, very often this person will stand up off the table. I'll have them come over to the wall so they can hold on to the wall for balance. I'm going to retest them. And they will literally say, "Oh my God, I can't believe how much better I feel." So this is the sacroiliac joint. Now, how do you know if you should be adjusting the lumbar number 5 or lumbar number 4? Now, in my professional experience, I have found that L5 is more often adjusted than the L4. If the sacroiliac joints are moving well, and what that means is I check both sides, the right sacroiliac joint and the left sacroiliac joint, with motion raising the left leg and raising the right leg in both scenarios. If the sacroiliac joints are moving well, then generally speaking, you can take your finger and push underneath the L5 vertebrae. Very often it will be tender to the touch, the ligaments will be strained, and that's how you know that the L5 is a problem. And very often I'll be adjusting L5 in that particular case. The only time that you won't be adjusting L5 is in the case of a spondylolisthesis. A spondylolisthesis, almost by now, you can almost see them from a mile away. Usually you're going to take an x-ray to uncover this, but the thing is that for the most part you know that a spondylolisthesis, the vertebral body goes forward, the spinous process comes back, something just doesn't feel right. And if you've seen hundreds of them, then you've seen thousands of them. Once you start to get a good palpation skills down, once you get your palpation skills down, man, you could find these spondylolistheses before you even take an x-ray. So in those particular cases, I would be adjusting the actual base of the sacrum underneath the L5. So hopefully this has been beneficial for you. There's one other test that I use that is not as valid, but I do often use it, is just general range of motion. I will watch a person move. I will have them bend forward to touch their toes. I will have them bend backwards. And for the most part, when a person has a positive Kemp's test or bends backwards, very often they can pinpoint with their finger exactly where it hurts. And that's usually where, with my other tests, it correlates well, and I'll adjust either the L5 or the sacroiliac joint. The other thing is for patients who are extremely large, where you don't even have to ask them if they're clinically obese, but they are. Usually what you'll find is that when they bend backwards, they get pain and they'll point to it right at L3 where the fulcrum is, and you'll see very little movement of the L3 to L5 vertebrae. It'll just be a block. In those particular cases, I adjust the lower lumbar spine, and very often it works really well for those patients that are large. Sometimes bending forward at the L5, you'll see very much flattening, but if it's a L5 subluxation, you'll see a lot more flattening. And so these are all clues that I've found over the years that help me determine whether I'm going to adjust an L5 or an L4 or the sacroiliac joint. So hopefully this helped you as a chiropractor. Also, if you're a patient, hopefully it helps you understand that there's a lot more to adjusting than simply cracking the back. When patients come in and say, "crack my back," they really don't understand the knowledge and the intricacies of spinal adjusting. And the more specific you can become in your spinal adjusting, the better results you have. That's why you can go from one chiropractor to another, and sometimes you'll get good results with one chiropractor and you just won't get good results with the other. And this is the reason why, because if a chiropractor is adjusting your sacroiliac joints and what you really need is your L5 to be adjusted, then you're not going to get results. And this happens in chiropractic, it happens in dentistry, it happens in osteopathy, it happens in medicine, that a doctor can actually be doing treatment and the treatment is simply not working because they're just 5 millimeters off. So hopefully this was informative to you. Thanks for watching, thanks for subscribing, and if you have any specific questions, just ask them in the comment section below and I'd be happy to answer them for you.